Hey, what's up YouTube? Back here with another Q&A, and we got a bunch of questions that I want to run through today, everything related from strength and conditioning to back pain that I think you guys will find helpful in terms of my responses to these questions. So, first question, hey Remi, do you know anyone like Miguel for the neck or upper back, or things you can possibly do to prevent disc-related injuries to the neck, or maybe do a video on that? So, I actually heard Dr. Miguel recently talk on a podcast where the neck is one area that someone should actually kind of look to doing further research on as a way to maybe be becoming the expert on that. So like Dr. Miguel's the expert on the low back. There really isn't a neck guy out there right now. There isn't anyone, at least I know, that I could recommend, because the cervical spine is completely different than the lumbar spine. Yes, it will become injured in a similar way, but the way the nerves kind of drag, the facet angles, everything is different. So it's going to have a different impact when it comes to maybe treating these issues, or the way that you're putting someone in a position to work around certain issues, say at work or something like that. The neck is just a whole different area. It's not something that I really specialize in or know a great deal about. But what I'll say is this: avoid flexion, extension under compressive load, those repeated cycles. If you keep doing that over time, you're going to create a disc issue. And there are devices like that out there where you may see people attach some sort of headgear to their head, and they'll move their head up and down with the purpose of strengthening some of the neck muscles, but really they could just be creating a recipe for disaster. And if you've ever seen like the Rocky movies, you know what the device that I'm kind of talking about there. Now, just a follow-up question to this. Do you think isometric holds and stiffening your neck during compound lifts helps in stabilizing the neck? Absolutely. I definitely think there's a time and place for this. So one way you can simply stiffen the neck is push your tongue to the top of your mouth, and you can hold that, and you'll feel some of your deep neck stabilizers activate. You could also do isometric holds, side, front, under the chin. Typically, this is an area that doesn't really get addressed, and these muscles do tend to be weak, but training them in an isometric hold where we're not going under flexion and extension, I think can benefit a lot of people, especially people with neck stiffness, similar to how we do side planks and planks for the low back. Number 3, I injured with a deadlift, but my pain is centralized in my back. I was lucky not to have the pain in my leg. That can mean I have a disc protrusion. Hard to say if it's actually a disc protrusion. What I would suggest is go see a therapist, doctor, get the proper diagnosis. You could have some referred pain. Maybe there's a disc protrusion. Maybe you have some degenerative issues of facets. Maybe you have spondylolisthesis. Maybe you have a pars fracture. It could be a number of things going on that could be causing that centralized low back pain. It's good that you don't have any pain going down the leg, but still it could be a number of things, and I would recommend just seeing someone, a good therapist, doctor, to get that checked out. Number 4, Remi, what are the solutions to sitting with back pain? The simple answer is to remove sitting until the tissue heals, and then you can go back to sitting and work with the tolerance that your back can handle. The thing is, prolonged sitting for anyone is not normal. It's stressful on the back. So when it comes to someone with back issues, you're already way behind the starting line. But there are ways to kind of work around this and improve it. So number 1, invest into a spine-friendly chair. Maybe that's investing into just an ergonomic kind of design chair, or a good lumbar support. Or you could also, another focus would be strengthen or build core endurance for the low back. That could perhaps improve your tolerance to sitting. But really, the key thing is just taking yourself out of that position until the damaged tissue heals, and then work with the tolerance that you can handle for sitting, and then just keep building until you can kind of sit pain-free. That would be kind of my suggestion there. Number 5, did you lose the capability to work long hours because of the limitations of recovery? I'm thinking of jobs where you stand all day, like McDonald's cashiers, for my own reference. So fortunately at the time I don't know if I'd say fortunately, but when I had my back issues, I was in school. So I was required to sit, and I that was one of my pain triggers. Standing wasn't something that really caused me issues. I could stand no problem, walk no problem. That actually provided me with relief. Now, I'm on my feet anywhere from 5 to 10 hours a day with regards to my job as a coach / trainer, and I have no issues with standing. Now, on the flip side, there are people that have back pain with standing, or that it's triggered by standing. So those people might be able to chime in a little bit more, that have just back issues from standing. Maybe that's more of your spinal stenosis cases, and they have maybe trouble with work. Feel free to maybe chime in if you're anyone out there with back issues with standing and you work maybe a job that requires you to stand. If you want to share your own experience, I would think it's very difficult, and there would be some limitations in there. I can't really comment, but all I can say is, going back to my experience, yeah, like there were times where when I was in class, I was popping painkillers just to get through the classes because sitting was so difficult. I did my best to manage it, and then I'd come home, just lay on my stomach, and then that would settle things down. Wasn't pleasant, but I was able to manage through it. But really, I didn't get back better until I kind of completely removed the pain-provoking position. So I think there's going to be some limitations there, but I'm sure others can comment. Moving on, question 6. Hi Remi, I have a bulging disc and have been off work for 6 months now. I have improved since my initial injury. I can walk, stand, exercise with minimal issues most of the time, but I'm having problem trying to improve my post-sleeping stiffness and soreness throughout my back. My physiotherapist says it's something I have to live with now, as this may not completely go away. What are your thoughts on this recommendations? So post-sleeping stiffness and soreness, well, the thing is I don't know if it's something that you can avoid, because the thing is when we go to bed at night, we are in that decompressed state. So our spine is lengthening, the spinal discs are absorbing fluid, everything's being stretched out. So when we wake up in the early morning, say first 1 to 2 hours, the spine is more stressed when we do bending activity. So a good example is if we did a sit-up as soon as we wake up versus do that in the afternoon, that sit-up is going to be about 3 times more stressful on our spinal discs. So as a result, that's why I don't recommend any bending activities, or be very careful with bending activities in the early morning. My suggestion would be maybe go for a 15-20 minute walk beforehand, just to kind of get loosened up a little bit. That'll reduce some of that stiffness, and it'll create some of that compression, expel some of that fluid out of the disc, and return us to that normal height, and reduce some of the stress on our low back. So avoiding that, I don't know if there's a way to avoid that, but my suggestion would be to go for a walk in the early morning. I think that would be important, and also just kind of minimize your bending and twisting activities in the first couple hours. Next question, Remi, what are your views about hollow holds for core strength? Big fan. I've been using them more frequently lately with a lot of my clients, and they're challenging. I would definitely recommend you incorporate them into your workout if you can tolerate them without any symptoms or pain. Next question. Hey Remi, have you ever considered stem cell treatment for your lower back or artificial disc surgery? If no, then it would be great if you could share the reasons. Okay, so stem cell treatment, I am not familiar enough with the process. I remember talking to my advisor when I was in my master's about this, and some of the things they're doing with stem cell treatment is incredible. They're recreating kidneys, lungs, hearts. It's definitely a field that's taking off, and will definitely probably be the future of regenerating organs and stuff. I don't know enough to really understand it yet with regards to discs and stuff. Artificial disc surgery, so that's kind of getting a disc replacement. The thing is the axis of rotation will never be the same from my understanding, and that could lead to some future arthritic changes with an artificial disc, just because the mechanics will not line up exactly the same with an artificial disc. It's just not the same as a normal disc, and at the same time, I'm pain-free. What's the point of having that type of surgery now? Back then, it's not something I really even knew about was possible, was artificial disc surgery. I know people that had it successfully, but there is that concept of the axis of rotation being off with an artificial disc, which could maybe lead to more stress on, say, the facets and creating new issues down the line. So that would be something to think about. People can get better with conservative treatment. Lots of people can. I did, so I don't really think. I think you want to avoid surgery at all costs because number one, you never know what's going to happen when someone opens up your back with the knife. Is it going to be successful or not? And if it is successful, really it doesn't solve the issue. The issue is because a lot of people end up just getting a relapse a year or two down the road. One, because they're just not educated about how their back issue was created, and they just keep doing the same things over and over again, and then bang, they wind up at square one again. So unless there's like a good follow-up process, then I wouldn't really, I don't really think surgery is maybe the route to go, and I think it would want to be avoided at all costs. So those are just my suggestions, but you can check out Dr. Stuart McGill's stuff for more information on that, and I would highly recommend checking out his book, Back Mechanic, and Low Back Disorders, if you wanted to go into more detail. Anyways, with that being said, that's it for this Q&A. I hope you guys enjoyed this, and if you have any questions for future Q&A, please leave them below. Okay guys, all the best, take care, see you later.